Morning, everybody. Good to see you all again. A couple weeks ago, after my swearing in, or a little bit more than a couple weeks ago, had a bit of a news availability, and you had some questions that I think I can provide some further answers to. Before I start that, though, I want to, of course, remind Manitobans that the best way through this pandemic is to get vaccinated. It's the best way to ensure that our businesses stay open, that our houses of worship stay open, that our schools stay open, and that we don't overwhelm the healthcare system. And so continue with that encouragement for Manitobans generally. I want to also thank the many Manitobans who've reached out to me and who've engaged with me over the last little bit more than 2 weeks now. Dozens and dozens of meetings, had the opportunity to attend the Peace Garden near Boissevain for the 20th anniversary of the 9/11 terrorist attacks, and a great opportunity just to, again, not only remember that tragic day, but to talk about the need for peace generally going forward in the world, and was pleased to be joined by Canadian American officials at that very unique place in Manitoba and North Dakota. Had a good meeting with the Grand Chiefs recently. Good discussions, open dialogue, clear and frank discussion, as those discussions should be. And I appreciated their comments as well, and their candor. And of course, I was honored to be able to invest into the Order of the Buffalo Hunt, the 2019 Grey Cup champion Winnipeg Blue Bombers, which I know is personally important to many Manitobans, including my family. In a time where there's a lot of challenge and difficulty, it's also good to be able to celebrate the things that we like to celebrate in more normal times. And I appreciate Wade Miller and Dana Spiring for being able to arrange that. So, as I mentioned a couple of weeks ago, there were some questions regarding things that I wasn't able to give details on. I wanted to update you on those things and report back to the media, as I promised that I would, on some things. Regarding the House, good discussions over the last couple of weeks with the NDP House Leader, Nahanni Fontaine, and the Liberal House Leader, Dr. John Gerard. So I believe that we've settled on returning on October 6th to the legislature, which would have been the normal start date for the Assembly to come back. Because we are not proceeding with the 5 designated bills, we spoke about that last time. There was discussions about the mechanism by which they wouldn't proceed in the House, so they'll be withdrawn on the first day of sitting on that October 6th. It requires unanimous consent. I'm expecting we'll get unanimous consent for the withdrawal of those bills as well on that day. Bits the Budget Implementation and Tax Statute Amendment Act will be tabled. Looking and hoping to pass Bill 72, which is the Disability Support Act, which is brought forward by the Minister of Families, our Deputy Premier, Rochelle Squires. So looking for support from the opposition to pass that. I know it's important to many within the community. The session will last 2 weeks, so the balance of that week and the balance of the next week, there'll be some later sitting dates and probably some late nights. There isn't a heavy legislative agenda, obviously, because the 5 bills that were the primary agenda are being withdrawn. But there is still quite a bit of budgetary process to go through. So the estimates process, that detailed, as you know, as reporters in the legislature, that line-by-line questioning of the budget, that'll continue on. I think we have about 56 or 57 hours left of that. So we expect to be able to get through that with some later sitting days and probably a couple of later nights. So I appreciate, again, being able to work with the opposition House leaders. I am still the government House leader, so despite taking on the role of Premier, of course, there are some of us who are doing double duty because of just the nature of what's happening with the leadership campaign, and so continue on as government House leader in that role. So I appreciate working with the other House leaders and the Speaker on this. There were questions last time that I was in this setting. I've had other media availability since then, but in this room, about the Council of the Federation and the meeting of the Premiers, which is scheduled to take place, I think it was October 5th to the 7th. So that was to be an in-person meeting held here in Manitoba. These are really important tables to be at. I was the chair of the health minister's table in 2018, and so I know how important these tables are. For those who aren't as familiar with it, Council of the Federation is just simply all the premiers who work together on a number of initiatives that are national in scope. Ministers typically have their own sort of national table, so the health ministers would meet regularly as an example, and the ministers of families across the country, and there's usually a chair. It alternates between provinces, and so it goes between the different provinces in terms of who's the chair that year. So Manitoba's turn to be the chair of the Council of Federations was this year, and so we were going to hold that in-person meeting, and I think the hope was that we could. But given what's happening in many places in Canada and the general state of the pandemic, there will not be an in-person meeting of COF, of the Council of Federations here in Manitoba, as was planned. And further to that, I mean, I know how important it is to have, consistency and stability at those tables, having done the health table for a year. And it's not really fair, I think, for the Council of Federations to have 3 chairs in about 4 months. So as much as I very much would have liked to have chaired the meeting, and we'll participate in the meeting, I think, next week. That'll happen virtually after the federal election. It's not good for the COF generally to have that kind of active changing of the chairs, and there'd be another, of course, change after our leadership convention at the end of October. So I spoke with Premier Horgan yesterday in British Columbia and asked if he would be agreeable for BC to become the chair of COF for this year, and for Manitoba then to resume chair next year. And we had a very good conversation, and he thought it was a good idea and agreed to do it, and so that'll be formally announced, I think, by COF very shortly through a news release. So I appreciate Premier Horgan making way for that. I think it'll be good for a COF to have that consistency. I'll be the vice chair, and Manitoba will be the vice chair for the remainder of the year. So I look forward to joining other premiers on those virtual calls in the time that I'm in this position. And I also look forward to the new premier being able to then host COF in our iteration when we take over later next year. There were also questions. I think the question came from Steve, although I know Steve's not here because he's off to an important event, but regarding the PUB and the hydro rate application. So because all 5 bills are being withdrawn on that first day of session, that also includes Bill 35, which is the bill regarding public utilities and rate applications and rate setting, which is supposed to smooth it out over a 5-year process, but there was an interim rate contained within that bill. There were discussions, I think, and questions from the media about whether or not a rate would be set in BITSA in the session. That won't be the case. Hydro has been asked to do an interim rate application. And so they will go through the normal PUB process, and then there'll likely be a general rate application next year, probably on a 3-year window for the setting of the hydro rate. So there won't be a hydro rate included in the Budget Implementation Act that you'll see at the beginning of session. And Minister Jeff Wharton will have more to say about that and more details in the days ahead. And finally, we talked a little bit about land acknowledgement in the legislature. As I mentioned at the last availability here in this room, I think its time has come. And it's important to have that in the Manitoba legislature, but it's also important to get it right. And I also think that consultation is important. I know I will disagree with my friend, the House Leader from the NDP on this one. I think consultation is the respectful way to do it. I also know that things that happen in the legislature tend to last for about 100 years, so I think it's important to get it right. So I've asked 3 MLAs to engage in that consultation and report back to me by October 22nd. Eileen Clark will be the lead in terms of that consultation for our caucus, joined with Greg Nesbitt, who is the caucus chair, and Andrew Smith, our MLA. So expected those consultations to go well. We need to get the wording right. Had a good discussion this morning with Brian Bowman about, Mayor Brian Bowman, about a number of things. This was one of those. I know the City of Winnipeg has done land acknowledgement in City Council for a long time, so he has some advice, and I think is willing to lend some of the work that they've done on that. So we'll be consulting with, of course, Indigenous leadership, but also the city, and taking up on some of their experience as well. So look forward to the conclusion of those consultations, and then bringing it to the Rules Committee of the Legislature, together with the NDP and the Liberals, shortly after October 22nd. So I expect that by the next session of the legislature, this should be formalized in the rules. Also, I think there's an opportunity with these consultations to use the text once the consultations are concluded in annual reports of government. So to have an acknowledgement, a land acknowledgement in the annual reports of government, I think is also important, and it would coincide well with these consultations. So those are the things that I promised the esteemed media in this room that I would report back on, and happy to take other questions that you have.
Premier, when it comes to Manitoba's COVID-19 response, who do you support, the province's top doctor or a fellow party member, Ken Lee, who's criticized, who's bashed Dr. Goertzen, similar to the way some Republicans have bashed Dr. Fauci in the U.S. I mean, who do you support, Goertzen or Ken Lee?
So Carol, that I'm not getting involved in the leadership race, and so there will be candidates who will make statements about a variety of different things, not limited to that. And as the Premier, I'm clearly not getting involved in the race, and as the leader of the party, I'm not involved in the race. There's this separate committee that makes sure the rules are followed and those sort of things. But I've said all along that we are working together with public health to manage this pandemic. There's always different questions that come up when it comes to public health, but when it comes to Dr. Goertzen's and others, we have good discussions, and we come out together unified on how we should be dealing with the pandemic. And so I appreciate the work of Dr. Goertzen and continue to support him.
You don't think he's failed Manitobans?
No.
Alberta, with all the issues that they're having with COVID and this fourth wave and the healthcare system, have they reached out to you? Has Premier Kenney reached out to you seeking help to reciprocate some of the ICU patients that we sent their way in the third wave, where we might potentially have some come this way, or have they reached out looking for other supplies or support?
There's not been a reach out from Premier Kennedy or Premier Moe directly, but I know that health officials, through the pandemic, are always talking to each other at that level, as they should, not just about ICU capacity, but a variety of other things as they're learning. So, I don't doubt that there are discussions that happen at the officials levels about a variety of different scenarios as they've been happening for 18 months. But there's not been a direct reach out. But of course, we benefited by support from Saskatchewan and Alberta, and particularly Ontario, during the third wave. And if we had the ability to offer support, I think that we'd want to, like we do in lots of different things. I mean, sometimes we get support for forest fires, and sometimes we offer support for forest fires. So regardless of what the situation is, whether it's health or other things, if we can support other provinces, if we have that capacity, then we would. But those would be health decisions based on what they're seeing within the healthcare system.
When you consider what's happening in those other provinces, I mean, how do you reflect on Manitoba's situation? Do you support what we've done so far?
So, I've learned, as you know, Ian, that things change quickly. And so I think we are in a good place right now compared to other provinces. But I also know that things can change day to day, and that we need to be mindful of that and continually looking at how do we ensure that we are still remaining in a good place. I look at what some of the other provinces are now doing in response to the into the fourth wave, and those are a lot of things that we did weeks ago. So in many ways, I think that we've been proactive in this particular time, and hopefully that allows us to have a bit of a steady state for a while. I know one of the frustrations that people rightfully have is that the orders change a lot. And that's not a criticism, that's responding to things as they happen, but it does cause frustration. It causes people to not always understand what the orders are. I think by being proactive on the things that we've done in the last few weeks has probably allowed us to be in a little bit more of a steady state. But every day is a new day in this time, in this pandemic, and so it would be foolhardy to make predictions. But I think at this moment, as we talk today, compared to other provinces, we're in a pretty good place.
Premier, how would you feel about being replaced by somebody who promises to undo a lot of the pandemic response, a lot of the restrictions, a lot of the efforts that your government has made to keep Manitobans safe?
So, I mean, I'm not, going to comment on the details of the leadership race or individual platforms that the candidates will have. I will be replaced, Carol. Every time I come here, somebody asks when I'm going to be replaced. I'll be replaced on October 30th, and that'll be done by the vote of membership. I've signed up to do this in a relatively short period of time, or for a relatively short period of time. And the party will decide who its next leader is, and by virtue of that, the next premier. So I'm committed to doing the best job that I can and make the best decisions that I believe I can make for all Manitobans in the time that I'm the premier, and the next leader I would hope will do the same.
You are, though, the interim party leader, and there are thousands of members that are adamantly against really the major decisions your government has made. What do you say to those thousands of members?
Well, there's lots of divide in society these days, and I think I said last time that's one of my disappointments and regrets, is that there is so much divide. In some ways, I guess it's somewhat unavoidable because there are difficult choices that are being made, and clearly people have very different views, and they're not always going to be able to bridge those views. What I ask people to do is to be respectful to one another and to each other. But while I'm in this chair as premier, I recognize that there are decisions that I'll have to make and that our government will have to make that not everybody is going to agree on. But they are going to be decisions that are based on the evidence that we have before us and that are in the best interest of all Manitobans now and going forward. The next leader of the party, I hope, would look through that same lens and do the same thing for Manitobans. These are not easy decisions. There are no magic solutions. Sometimes you are just choosing between bad choices in a pandemic. And I recognize that, and I knew that coming into this job even for a short period of time. But that is sometimes what has to happen in we're at this moment in a good place, but I don't doubt that there might be difficult choices to come yet.
What kind of executive powers would somebody have if they won the leadership and became the premier and they weren't a member of the Legislative Assembly?
Well, that's a good question, Tom, and I don't pretend to be, a parliamentary scholar. Well, you might be the closest we have, actually, so I might defer to you. But, my read of it is that if somebody is elected the leader of a party that has the majority of a house, I mean, they become the premier, but they're not able, unless they have a seat, to enter the house. So, there would have to be, somebody in the house who would, take the questions. But that presumes the outcome of the race, and I'm not presuming the outcome of the race. So we'll let the party members make those decisions, and and then we'll go forward on October 30th.
But hypothetically, what executive powers would they have? Would they have all the same executive powers that any other premier has? I mean, you have executive powers right now, whether you're in the House or not. You can pass orders in council, you can make certain appointments. The executive powers of a first minister are substantial. Whoever wins this leadership, if they hypothetically were not an MLA, would they have those same executive powers
So
immediately and automatically?
yeah, I don't know if Professor Cooper, Professor Thomas would be a better person to ask of that. My read of it is that a person who is elected a premier is elected premier. So.
Would your caucus support a leader that is adamantly anti-vax?
That is well down the hypothetical rabbit hole, and I appreciate you want me to go down that hole, but I've made the determination to stay out of the leadership race, and so I will stay out of the leadership race and won't make speculative comments about what the party will decide, other than to say, you know, during my time here as Premier, I'll make the decisions that I think are, together with my cabinet colleagues and caucus colleagues, that are in the best interests of Manitobans in the long term, and that's the scope that I look through it. I'm not looking through it in the scope of what party members might feel or what different factions of Manitoba might feel. I live those challenges and those difficulties, and I understand those, and I understand the division. I understand the divide. I don't like it. But that doesn't influence the decision making. I have to make the decisions based on the best information that we're provided, looking at what's happening in Manitoba and in other places, and doing the best that I can and that our cabinet can in this time, irrespective of what's happening in the party, but what's in the best interest of Manitobans overall.
Can you talk about the decision to just withdraw the 5 bills as opposed to proroguing or other mechanisms that could have been used?
Yeah.
Why that one, and to carry on with Bill 72 as opposed to just wiping the entire slate clean and starting over after passing BITSA?
People are going to be turning off the channel if I get too deep into like legislative procedure, right? I mean, why this might interest me, I don't think it interests many people beyond this room. Well, there was a couple of things, as you mentioned, we could have done, right? I mean, we need unanimous consent to withdraw the bills just by virtue of the rules. So, I didn't expect that would be a concern or problem with the opposition, but I never presumed these things either. So, wanted to, go through that negotiation process and to ensure that we had some sort of clear path in what this legislative session would look like, and not get the budgetary stuff hung up, because that's important for programs and for people within the public service who need to get paid. So. It was really a negotiation. It was always a preference, I think, to withdraw the bills and find a clear path in terms of what this legislative session would look like, both for the benefit of government and the benefit of opposition. I mean, there were mechanisms by which we could have not had a debate or not completed the 56 hours of estimates. I don't think that would have been good. I think it's important for opposition to be able to ask questions of me and others in the Executive Council and Cabinet. And so it was a negotiation to make sure that we could properly withdraw the bills, but also that opposition could ask questions in a time when they should be able to ask questions. I was in opposition a long time, and I see the importance of that. So, again, I want to thank the NDP and Liberal House leaders.
Was land acknowledgements part of that negotiations? And then obviously that's something that Nahani Fontaine has been pushing.
Not part of the negotiations, something our party thinks the time has come. We want to get it right, so we'll engage in consultations. I understand the other two parties are supportive of it as well, so we'll certainly engage them as we get into that process of the Rules Committee in the House. But I think it's now not a matter of if it happens, but how it happens. So we just want to make sure that it gets done right.
Does your government have any new ideas or new strategies on how to combat the misinformation out there with regard to, anti-vaccination or even just vaccine hesitancy? It seems to be really the thing that's holding back the province from getting past the pandemic, is getting past this misinformation. And I know it's a difficult situation, but are there any new solutions, any new strategies that government is talking about to be able to combat that misinformation? Because it really seems to be the root of all our problems right now.
Yeah, I mean, I don't know if it's the root of all of our problems, but it certainly is part of our problems. Yeah. Yeah, I get it, Tom, and I get the question, and I get where you're coming from on it. I wish there was an easy answer to it. As you know, information spreads and misinformation spreads these days in a way that, we couldn't have imagined 20 years ago. So government's always engaged. We talked a little bit even with Dr. Reimer yesterday about, how can we be more out front and more clear in terms of, the efficacy and the safety of vaccines and trying to dispel misinformation as it comes up. I know that the vaccine task force is doing their best at trying to get that out as quickly as possible. So we talked a little bit about how we can be more responsive more quickly, but it's not a challenge, I think, that we're going to easily solve because of the nature of how information is spread these days on social media, but not just social media. But all of us have a role in it. But I don't pretend, Tom, that there's an easy answer to it or a magic solution.
Thank you, Mr. Premier. We will go to the phone now. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning from CTV Winnipeg, Jeff.
Oh, hi, Mr. Premier. Could I just get a clarification on the hydro rate? There's going to be an interim application, and will that set the rate you said for the next 3 years, or will there be an interim one and then another one next year? If I could just get a clarification on that.
Yeah, thanks, Jeff. And I will leave the details to Minister Wharton, as he's the minister responsible and by therefore the expert of it within our cabinet. It'll be an interim rate application that'll set the rate, I think, for this current year, and then a general rate application would take place next year, I believe, for the following 3 years. So there's this interim period between now and next year, and then a GRA, a general rate application, that would happen through Hydro and the PUB that would take place next year for the following 3 years. That's my understanding of it.
Okay, thank you. And the fact that there's going to be a general rate application for 3 years, is that a signal that there's no desire to bring back another version of the bill that will be withdrawn? Or I guess a new premier could do whatever a new premier wants.
Yeah, I can't really speak for everything that a new premier will do. I think the desire of our caucus and cabinet at this point is to, be able to bring some certainty in terms of rates. That is actually what the intention of the bill is to provide, broader certainty. I know there was questions about how that certainty happened in the PUB process. So maybe this, helps to achieve both, to ensure that the PUB process is engaged, but then also there's a longer term perspective because it's important for people to have sort of rate certainty going forward. So again, can't speak for everything a new premier will or won't do, but I think it's the desire of caucus and cabinet to see both the process happen through the PUB and to have some rate certainty for Manitobans going forward.
From the Brandon Sun, Kyle.
Good morning, Premier. Is Manitoba prepared for the fourth wave with regards to pediatric hospitalizations, specifically ICU beds, especially with the return of school last week?
Yeah, it's a good question. I did have some discussions along with our cabinet with public health yesterday in terms of the fourth wave. My understanding is that in terms of pediatric beds, there is an ability to fairly significantly increase the number of ICU pediatric beds. So that work has been happening together with our Minister of Health, Audrey Gordon, I think previous to that as well. So there's been work on that, and they do have the ability to increase the pediatric bed ICU capacity. But the details in terms of the number, I'll leave to them. But it was significant. So there's been good work on that, and hopefully we don't need to use it. But obviously, the preparations is important, recognizing that their healthcare system is under stress and they're strained, and so it's not going to be easy or maybe as high as anybody would want in situations. But the work has certainly happened, and there has been results from that.
Okay, thank you. And how did the meeting with the Manitoba Government and General Employees Union President go a couple of weeks ago when you guys were discussing healthcare support staff voting for a strike?
Are you talking about the meeting with Michelle Gronsky?
Yes.
Well, Michelle and I, we've had long relationship. She doesn't live that far from where I live, and So we've talked a lot in when I was health minister and different sorts of things. It was a good meeting. I mean, don't get me wrong, we didn't solve every difference or outstanding dispute that exists within government and with MGU, but I think there's a willingness to continue discussions. I recognize the challenges that her members are under, and she's, representing her members and her membership in the best way that she can. But I appreciate the work that she does and that she has to advocate for her members, and she did a good job of advocating, and we listened and certainly brought some of those concerns back to health, and we'll continue to try to work with them.
From CJOB, Schuyler.
Hi, Premier. AMC Grand Chief Arlen Dumas had some pretty strong words against Manitoba Hydro earlier this week. He said Hydro is treating First Nations as second-class communities. I know that was one of your first calls as soon as you got in office. I'm just wondering if you think Hydro is doing enough to restore power to Little Grand Rapids and Pangasi First Nations right now.
Yeah, thanks for the question. And, I've had some good discussions with Grand Chief Dumas and have appreciated, the concerns that he's raised, not just on this file, but on other files. And I hope that we'll be able to take some action on it. Specific to this file, I understand that there are, going off of memory, but I think 88 power lines that need to be repaired. I think as of this morning, they had repaired about 50. So I know that they're working, as hard as they can. I know that Grand Chief Dumas was talking about potential interim power supplies. I have raised that with Hydro officials. I think that, their analysis would be that it might be as long to get the interim power supplies, it might be to get the remaining power lines fixed. So I know they're working, as hard as they can and as quickly as possible. I do believe that they see it as a priority, and they're doing the best that they can in pretty difficult circumstances. And I appreciate Grand Chief Dumas raising it, though, and I've raised it with Hydro officials as well, and I know they're going to continue to make this a priority.
Thank you. When it comes to enforcement on public health orders, mask mandates, and vaccine mandates in some industries, it seems the third, fourth time around, people are getting pretty dug in. Is there a change in strategy coming for businesses that are, they know what they have to do, but they're just choosing not to do it on their own?
Yeah, I mean, so, the enforcement side of things has been a challenge for 18 months, not just on non-compliance, but in terms of who can do the enforcement. And of course, the rules have changed a lot over 18 months. And so that has sometimes become a challenge. So, we continue to work with the enforcement officials and with the Department of Justice and the Minister of Justice about, are there ways, it's not just about, enforcement, it's also about education. So, how much of it is that there isn't an awareness of what should be done, and how much of it is that some people just don't want to follow the public health orders. And so it's a bit of a balance, but we've made commitments to enforcement, and those commitments remain. So we continue to work with justice officials to see where there are challenges and sort of what the root of those challenges are. It's not always just as simple as that some businesses or individuals are refusing to follow it. Sometimes there's other sort of education matters that have to happen.
From CBC Radio Canada, Charles.
Good morning, Premier. Question I have for you. When will the list of the candidates into the race to become the party's next leader and Manitoba's Premier will be published?
That's a determination of the party. I think that there is a subcommittee that's struck for the leadership process that does the vetting of the candidates to ensure that they're following the different rules that have been set out. So I know the deadline was yesterday, and I imagine that they're going through the process that they need to finish going through. And I don't think it would be long, but I'm not on the committee, and I'm not instructing them to produce anything in any particular time.
Thank you, Premier. And I know you said you would like to stay neutral, but some candidates into the race for Premier said they were against vaccine requirements. So as the actual Prime Minister, what is your position on that matter?
Well, I appreciate you electing me Prime Minister. I'm not the Prime Minister. I have no desire to be Prime Minister, although I didn't want this job either, and then who knows. No, I appreciate the question. As the Premier, My position is that it is important for people to get vaccinated. It's the best way for us to get through this pandemic. It's the best way to keep our businesses, our places of worship, our schools open and not overwhelm the healthcare system. So while I'm in this chair, I will continue to encourage people to become vaccinated, those who are not vaccinated, and will continue to work with public health in the best that we can to ensure that whatever is coming in terms of a fourth wave is blunted, and that we don't end up in a situation where we're not able to provide the health care that people would expect, or that thousands of surgeries again get canceled. Those are very real concerns. I know sometimes that, well, not sometimes, I know that, that those decisions are sometimes divisive for people, and it results in division. But when I took this job and I swore the oath of office, even for a short period of time, it was to ensure that the best decisions got made for all Manitobans, even if not everyone agrees, and that's what's the guiding principle for us now, and hopefully those will be the guiding principles for the new leader, whoever he or she may be.
From CBC National News, Cameron.
Hi, Premier. Just on the notion of potentially helping other provinces on COVID in the fourth wave, looking at our numbers right now and looking at what's happening here, how might Manitoba be best positioned to do that? Would it be sending staff out, bringing patients in, sending out equipment? Just kind of curious where we're best positioned and what you may actually feel most comfortable with.
Yeah, thanks, Cameron. So, I mean, it's not a decision that I as Premier would make. I mean, those would be healthcare decisions based on what the health officials feel they're able to provide and what other provinces may or may not need at any given time. So, yeah, you'll remember that during the third wave, you know, we got assistance when it came to some nursing staff, and of course we were able to access ICU beds in other provinces. That's what we needed. At the time, we weren't in need of, you know, ventilators or PPE. I don't believe that wasn't our limiting factor. And so, you know, depending on what other provinces may need, if they actually put in a request, I mean, we would then look at that with our health officials to see if that could be accommodated at the time. So we're grateful for the fact that other provinces, you know, helped us during the third wave. We've helped other provinces for different things at different times, and so, you know, if there was an opportunity and health officials felt they were able to do so, and if a request actually came in, you know, that's something we would consider, obviously, at the time.
And lastly, on the fourth wave here, looking at what's happened in Saskatchewan, looking at what's happened in Alberta, albeit there have been different restrictions through the summer in those two provinces compared to ours. How concerning are those situations, looking at what's basically happening next door to us?
Yeah, I mean, it's always concerning, right? And I think that we know that we're not immune to any of this, and that the challenges that exist in Saskatchewan and Alberta could exist in Manitoba again. I think that's one of the reasons that we took, you know, proactive measures a few weeks ago. We've had the mandatory indoor mask mandate for public places for a while now. We implemented it in schools at the beginning of the school year, not without some degree of controversy, of course, and that's true for every decision these days. We brought in the required testing provision for certain sectors if individuals aren't getting vaccinated. I think we'll have more to say about that next week. Again, all of these things had some degree of controversy around them, but now we see that other provinces who are well into their fourth wave are doing the things that Manitoba did well before we got into a fourth wave scenario. So hopefully that helps to blunt some of that effect and allows us to keep those businesses open, those houses of worship, schools, and not overwhelm our healthcare system. There's no perfect answer, I don't think, to any of these things, but I think that proactive measure puts us in the best place possible.
Thanks.
We now return to the news conference theater.
On Indigenous land acknowledgements, why is your Indigenous reconciliation minister not on the working group? And correct me if I'm wrong, I guess 3 MLAs that are on the committee are all white.
It's of course, you know that, Eileen Clark, who is the chair of the committee, has a great deal of respect from those who are in the Indigenous community for her work when she was the minister. So I think that she's an excellent person to lead that work, and I don't think that you'd find anybody within the community who would largely disagree with that. The reason that they're members of the caucus, and it's a good question, Ian, is because it's a little bit separate from executive council. So the rules of the assembly are really rules that govern MLAs generally and not executive council in particular. So the assembly is different than cabinet per se. As premier, I'm the premier for the province, but I'm not necessarily, the premier for the assembly itself. It has its own governing set of rules, and it doesn't function the same way a cabinet would function. So I thought it was important to have three members who are not a part of executive council, but who are members of the assembly lead that, because ultimately that recommendation will come back to me as House Leader. Again, I'm wearing a few hats right now. And then it'll go to the Rules Committee of the House, not of Cabinet or Executive Council. It will ultimately be a Rules Committee of the Manitoba Assembly that'll make that final decision. So that's why they're not members of Executive Council.
Why not make it an all-party committee?
Well, I think the other two parties have already indicated that they are supportive, that they have their own ideas of what the land acknowledgement should be. So because they've already sort of come to that conclusion of what things should look like, we thought we would go through a consultation process first externally. I think we will then bring in Tom, the Liberals and the NDP, and because we have to, and because we want to, but it has to go to the Rules Committee. So ultimately it becomes an all-party decision. But I think to some extent they've gone through their own process already individually, and so we'll go through our process and then we'll collectively meet. And I don't think there's going to be a lot of differences. I mean, I think the wording is important, so there might be some questions around that, but that'll collectively go together then through the Rules Committee.
Do you envision it as being a daily acknowledgement that gets said at the same time as the prayer once a day?
That would be, if I were giving feelings on it, that would make the most sense to me. But again, I don't want to jump ahead of consultations. There's reasons why we're doing it, because others might have different views. There might be different reasons why it should be done in different parts of the day. During my time in the legislature, that would seem like a natural fit, but let the consultations work itself out.
I think it's important to do it.
It probably should have been done a while ago. I think it's important to recognize that not only is the legislature on land that was first inhabited by our Indigenous people, but I think that daily reminder about the importance of reconciliation. I know it's not specific to reconciliation. It doesn't speak specifically to the Truth and Reconciliation Commission, but there is something about a daily reminder, and if it happens at the beginning of the day and before question period, and you know what question period is like, I think that is something that will benefit all MLAs. And my hope is that it doesn't become something that just sort of becomes, routine, and it just happens and people don't think about it. To the extent that, everybody is reminded about the importance of the fact that we are all treaty people and that we are on land inhabited by the Indigenous people first. I think that's a good daily reminder.
Why didn't it happen before? Was there opposition within caucus, or was it just a matter of doing the work and that work never got done?
Yeah, I mean, I think, there's a lot of different things that happen in government, and I'm not making excuses, and to the extent that people want to say, well, it's my responsibility because I was the House Leader, they can say it's my responsibility. But I think that there's a time for things. This probably should have been done sooner. Sometimes, there are events that happen that help clarify things for individuals, and that you have experiences that help to crystallize the need for certain things. That might be true as individuals, that might be true collectively for us as a society. This isn't specific to it, but I know when the unmarked graves were found in British Columbia, and had the opportunity to come in and meet with residential school survivors and lower the flags at that time. It was a moving experience for myself and for my family, and we learned a lot that day, and we've learned a lot since. So I'm glad that it's happening now. I'm glad I can be a part of it, and to the extent that it should have happened sooner, I don't disagree with that. But I'm glad that I think we're moving in the right direction now.
City News visited southern Manitoba yesterday and talked to several individuals who expressed that they weren't vaccinated, and the reason they weren't was they felt like it was being forced on them. I appreciate your response earlier was we need to increase education, but that sounds like an emotional resistance. Is there alternatives beyond education that we can use for this portion of the province that is still the lowest vaccinated group?
It's a good point though, and when people, and it's why I've tried to use language that isn't forceful. There are some people who feel that the vaccine is being forced upon them, and so sometimes people talk about forced vaccination or vaccine mandates. Well, that's not what we have in Manitoba. We have a required testing provision if you're not vaccinated. So I think language sometimes matters when we're speaking about these things. I think your approach sometimes matters. Mentioned this last time, but I don't know of anybody who's changed their mind in an argument on Facebook. Where I've seen people make a decision to become vaccinated when they weren't going to be vaccinated, it is because, particularly in recent days, because you're having those individual conversations, or there's somebody they trust in the community or in their circle of friends or in their business. That's ultimately, I think, where we're probably moving the dial on vaccination now at this rate, and so that work has to continue. But sometimes language matters, and sometimes tone matters, and I don't want people to think that it is a forced choice. I want people to know it's the right choice. And so how we message that it's the right choice and not a forced choice isn't easy, but it's important.
You've talked about that need for respect and calm between whether you're vaccinated or unvaccinated. We're hearing more and more conflicts and issues coming out of southern Manitoba, specifically Winkler. How concerning is that for you, and are you hearing these points where people are getting into conflict and it's going beyond just an argument or a discussion?
I hear about conflict. I don't hear about it just in one area of the province. I think that there are people with very strong views throughout the province on this, and I do worry about conflict. It's one thing to disagree with another person. It's another thing to enter into some sort of conflictual engagement with them. And I made that point when it came to the protests, right? When there were discussions about protesting in front of the hospital. It's not appropriate. It's not the place for that kind of demonstration. You can intimidate people going into a hospital. You can prevent people from maybe getting treatment that they need. And it doesn't quite make sense because the people in the hospitals aren't making these decisions. And so if you want to have a peaceful protest at the legislature, that is absolutely within your right as a Canadian. If you want to have a peaceful protest at City Hall on some issue, you can do that as well. I mean, we're elected officials, and that's part of what comes with being an elected official. But I would implore people that I know it feels like this is going to last forever. It's not going to last forever. But the actions that we take and the things that we do, some of those memories are going to last forever for people. And to the best that we all can, we can disagree. We don't have to be disagreeable on things. And I would ask people to remember that the decisions and discussions that are happening with public health officials are all with one goal, and that is to keep things open this fall so that houses of worship can stay open, and businesses and schools and hospitals don't become overwhelmed. Those are the goals. So you may not agree with the mechanism by which those goals are being met, but those are the goals, and hopefully everybody can at least agree on that. And just remember, this won't go on forever, but the actions that we take and the things that we do, those memories might last forever. And I don't want to see that.
The optic, I think, is that church leaders hold a lot of power in southern Manitoba. Has the government reached out to church leaders to try and empower them to speak to their congregations with compassion or address this issue from maybe what I'll call the grassroots of that region?
Yeah, you know what? I've had a lot of discussions, both in my role as an MLA and as a minister, and then a little bit more recently as the Premier with discussions with leaders in the faith community. Overwhelmingly, I find them to be respectful, that they're engaging with their congregations or their different places of worship. I think they're engaging with them respectfully. I think they're encouraging them to be respectful. That has overall been my my experience. I believe that 95% of faith-based leaders, while they may not agree with everybody, are asking their those in their congregation to act in a way that is reflective of the faith that they are practicing. I know that there are some that sometimes get attention that might not be in the same way, but I do think that 95%, if not more, of those faith leaders are engaging with their those in their congregations to say, reflect the faith that that you're practicing and representing.
You said that some people just don't want to follow the public health orders. In those cases, should the public health orders be enforced consistently in all jurisdictions of the province? Because we're hearing that there's a lot of times where they're not being followed and they're not being enforced in some parts of the province.
Well, I mean, the province has taken pretty significant efforts, Carol, on enforcement over 18 months. And I think that, we're not going to be able to have enforcement officers everywhere at every time. So I think they're trying to do their best where they see there are challenges, whether that's in certain industries, for example, or certain sectors, to do their best on enforcement. But I can't pretend that in every place where there is somebody who's not following a public health order, that there's going to be somebody there to enforce it. But I do think that the province, as much as any province, done their best to find ways to enforce it. But we're 18 months into this, and it is getting more than 18 months, and it's tiring for people and it's frustrating for people. And I understand all of that. It's tiring and frustrating for elected officials too at times. So the enforcement is happening, but it's like anything. I mean, there are people who will drive a little faster on the Trans-Canada Highway, and there's not always a police officer there to enforce that because they can't be everywhere.
Based on what you've been briefed on from public health officials, is there any sense as to what the level of immunization needs to be at before we can start talking about relaxing measures?
I think that there's sort of a reluctance, Tom, and to be that specific in terms of the individual targets, because they've put out targets before, and then the Delta variant came along and it changed those targets, and that's how this is evolving, and that's how I guess science evolves as different things happen. But that causes frustration for people because they hear different targets and then they change and they wonder what's happened. So their goal, I know, is just to get as many people as who are willing to get vaccinated. There's going to be more information coming in next week in terms of some of the strategies around that. I think they have some new strategies in terms of trying to increase accessibility for those who want to get vaccinated, but maybe there's been just accessibility issues towards it. So I think there's more strategies on that, but I think they're a little reluctant to sort of put out a lot more targets at this point.
Manitobans assume that the current measures that are in place, including with respect to vaccination, proven vaccination, will remain in place until such time kids under 12 become eligible for vaccination, and the majority of them are vaccinated?
Yeah, difficult for me to predict. I mean, it's probably a better question for some of the health officials. Probably difficult for them to predict too, because part of that is, it's hard to know exactly when that vaccination will be available for those 5 to 12. Hear different things. In the United States, are talking about that potentially being available within a month. Our health officials, I think at one point, were hopeful that it would be available next month, and that seems to be less likely. More likely that it might be early next year. So they might be reluctant to sort of make those sort of predictions and on the public health orders. I know at this point it's good, I think, as much as possible to have sort of a steady state where the orders aren't sort of changing day by day. I know that's been difficult. I think that's one of the benefits of having been proactive, is then you don't have to make a lot of changes. Some people, and I've heard from them, would have been critical, a few weeks ago when new orders came in place and said, well, this is, isn't borne out by the epidemiology, and I'm not an epidemiologist, but everybody is these days. So there would have been, folks saying that. But I think one of the benefits of that is it allows us to be in a more of a steady state for a longer period of time. And that itself is beneficial for a lot of people. And those constant changing of orders I know is difficult on businesses and people generally. So to the extent that, things came in a bit earlier, not only is it beneficial for blunting the fourth wave, but I think a steady state, as long as that can be held, is beneficial for people.
Will question period only last for 2 weeks?
Boy, question period feels that like it lasts like 2 weeks every time I go into it. That would be my expectation. So there'd be a question period on that first Friday. There normally wouldn't be. So we come back on the Wednesday, Thursday, Friday, and then there'd be question period for the days that we sit. The following week, I know that Manitobans cling to question period. It's like watching the Bombers or the Jets. It's that exciting, but it's important. The democratic part of question period, while it doesn't always look that way for folks, it's important. So we'll have question periods on every day that we're sitting. Okay.
And just why BC for the COF meeting to chair it? Was it their turn next, or?
Yeah, I believe it was their turn, and also, they're not sort of facing an election in an imminent way and that sort of thing, and so it seemed logical. And again, I want to thank Premier Horgan. It was very gracious of him to sort of take this on. I think he's now actually the longest-serving premier in Canada, so it might make sense from that regard. And it's only been elected for 5 years, I think, so maybe that shows. I'm only going to be here for 2 months, so he's a lot longer. But I think it made sense both from where they were in the turn cycle of COF, but also being the senior premier in Canada. Thanks again, everybody.